everyone, welcome back to another 𝗂𝗶𝗵 discussion. So today I'm here with 𝗥𝗶𝗵𝗆 and the topic that we have picked for today's role play discussion is very interesting. So it is about blood transfusion.
They will be thinking what is different
Yeah,
in
absolutely. This. So the thing that is different here is that the parent of a 16-year-old boy is denying blood transfusion because of cultural and religious beliefs. Yes, so it is going to be a very tricky one because the parent is not at all convinced whether, even when
after saying everything.
Yes.
So you're not going to convince him at all, actually.
Yes.
I mean, we are trying to convince him, but he is not at all getting convinced.
Because he is very much involved in his cultural and religious beliefs. So in such cases, we cannot force them.
And the main part is that we are not forcing him. We are respecting his decision.
Values.
Yes.
And then we are explaining what is the procedure we have to do. So
yes.
we are not going to break all the suspense here. So I'll play the part of the nurse and Grace will be handling the part of the stubborn parent. So let's get started.
Your time starts now.
Good morning.
Good morning.
Are you Martin's father?
Yes.
Hello there. My name is 𝗥𝗶𝗵𝗆, one of the registered nurses working in this hospital ward. I'm here to discuss about the blood transfusion that has been advised for your son. So I'm here to talk about that to you.
Oh.
So he met with an accident. We can see that from the case report. And in that accident, he lost a lot of blood. So in order to avoid any further unnecessary complications, it is important that he undergoes the blood transfusion. So that's the reason why I'm here.
Okay. So let me tell you, try not to waste your time. I don't want to give him blood transfusion because I don't totally need it. We don't totally need it.
Oh, I do understand that there are certain things worrying you, and I would like to know more about it as well. So before we get into further discussion, could you please help me with your name?
You can call me James.
All right, James. So could you please tell me what exactly is the reason why you are denying the blood transfusion?
This kind of procedures like blood transfusion is totally against our cultural as well as religious beliefs. So I don't want to give him this procedure.
I do understand that you are so involved in your cultural values and your religious beliefs, and I do respect it as well. However, given the situation of your child, it is very important that he undergoes a blood transfusion as he lost a lot of blood during the accident. And in order to avoid any sort of unnecessary complications like having severe fever, mild jaundice, or any decline in the hemoglobin concentration, or if you are not giving him a blood transfusion right now, it can even cause any sort of permanent disability in your child. In these worst case scenarios, it can even cost his life. So this is very important, and I hope you understand.
See, I'm least bothered about all these complications, and I'm not going to give blood for my child because I respect my cultural beliefs as well as I want eternal salvation for my child.
I do understand that you have a very strong cultural belief and religious values. That is completely respectable. But it is very important that we treat your son at the moment too. I hope you understand the seriousness of it because if we don't provide the blood transfusion right now, it can cause many complications like I told you earlier. So could you please reconsider it?
See, please don't insist me like this. You have been insisting me for the past few minutes, and I already said you know to waste your time speaking me regarding this blood transfusion because anyway I'm not going to give my child blood because it is against our cultural beliefs, and I'm too much into all these cultural beliefs and religious things. So please don't insist me. I cannot give that.
Please don't be worried. I'm not trying to tarnish your cultural beliefs and your values of that. I was just trying to explain the importance of blood transfusion for your child given his circumstances now. However, I would like to also explain about the hospital policy if you are denying the treatment because your son is just 16 years old. He's a minor. So as the legal guardian, you do have the right to decide about his treatment. So in that case, if you're denying the treatment or the procedure, then we won't be bearing any sort of risks associated with that. Okay, so we would also require a written consent from your side saying that you are responsible for anything that might happen in the future.
I can give you any consent like that, and I can take up any responsibility associated with it.
Yes, well, in that case, I can make arrangements for the written consent to be made. However, I hope that you will reconsider your decision because it is very important that we provide blood transfusion.
No, please don't think anything like that. I'm not going to change my decision.
Well, no problem. It's totally up to you, and you can make the decision for your child as well. Well, in that case, do you have anything else to discuss with me?
No, nothing more now.
Well, so please wait here. I can send another nurse with the written consent form, and you can read the details and sign that one.
Sure,
okay?
I can.
So in case if you have any second thoughts, feel free to contact me.
Okay,
all right?
but I don't think that will happen.
Anyways, I hope I have clarified everything for you. If you need anything, feel free to contact me.
Okay.
Thank you so much for your
Thanks.
time. Well, that's the end of this cue card, and Grace, it was very interesting, right?
Yes, because the father was too defensive and it was very difficult to
convince the
convince
parent.
him. Yeah.
And personally, I haven't come across any cue cards like
Even
this.
me.
Like where we are trying to...
I think I have seen around 150 or above cue cards, but never have seen such a reluctant father.
And that too with cultural and religious
Yes.
values. Okay, that is sounding really interesting, and I hope you guys also learned from it. So in this case, we cannot hurt the emotional values and the cultural values of the father, and you have seen it that the father was not at all convinced, and it is the cue card is like that too. You cannot demand or force the parent to change his cultural values or beliefs, right? Only thing we can tell him is the importance of it and the complications
So what
associated
happens
with it.
here is students whoever get this kind of cue cards will never conclude it. They will go on think that the father will at some point he will try to understand the points and he will get convinced.
That's
but
right.
If your cue card is like that, understand the cue card, and if they are not going to agree with your terms, try to conclude it according to whatever statements is given in the card.
Yes, that's right. So I hope it was clear for you guys. You can refer the video as a reference to handle such patients in the future. And straight after this video, there will be a feedback session where you can learn to create statements for each task in a very easy manner. So Grace and I will be back with another role play. Until then, take care. Bye-bye. Hello everyone, welcome to the feedback session. My name is 𝗁𝗶𝗃𝗀𝘁, one of the expert OET trainers from IILT. So we just watched a video where we were talking to a parent who's denying the treatment because of the cultural values, and we saw how we can tackle the situation as well. So in that particular video, the demonstration of the role play, we have shown you how you can move from one task to another, or how to make the entire conversation more interactive. So you can refer to that as a demonstration of how to do this role play. In this particular feedback session, what I'm going to do is to take you through each task, just the sentence construction. So I'll be picking each task and show you how you can construct a statement for that particular task. So let's get started. Alright, so this is a cue card. We have a setting, we have the background information, and we have 5 tasks to do in this one. So let's have a look at it. You can pause the screen and set a timer for 3 minutes on your mobile phone and try to prepare for this, because you have already watched the demonstration of this. So you'll have an idea about how to do it. So now take a piece of paper, pause the screen for 3 minutes and try to prepare it and make some notes, okay, so that you can cross-check your preparation with how the sentences are mentioned in this particular discussion. So here our background information is, you are talking to the parent of a 16-year-old boy who lost a lot of blood in a road accident. The doctor advised blood transfusion, but the parent is denying the procedure due to cultural beliefs. So it is a known case, right, because the boy is already there, so we would know the name of the boy, and we can ask the name of the parent during the conversation, as I have shown in the role play video. So you can refer to that. So here let's look into each task one by one and see how we can construct statements. So first task is greet with warm greetings and explain why you are there. So we're going to start like this. Good morning, and we're going to confirm the relationship. Are you Martin's father? So the name Martin is the name of the patient, and you need to know that before you start the role play. So you can ask the interlocutor, how may I address the patient in the role play during the 3 minutes preparation time. And you're going to confirm the relation, and then you're going to move on with your introduction by saying, hello there, my name is Richard, one of the registered nurses on duty. And you're going to state the purpose of the discussion, or why you are there, okay? So because you have to explain why you are there, so you can start by saying, I'm here as told by the doctor to have a discussion about the blood transfusion advised for your son. During the accident, he lost a lot of blood, and in order to avoid any unnecessary complications, it is important that he undergoes blood transfusion. That is the reason why I'm here. So you got all this information from our background details here. We can see he met with a road accident, and we can see the doctor advised blood transfusion, and we can also see that the parent is denying. So we are keeping this portion, the denying portion, later, because we have the task which is to be done later part. So we are keeping it aside. We are not going to discuss that right in the beginning, okay? If you want, you can do that too. You can start by saying, I've heard that you were denying the treatment, may I know the reason why. You can do that too. But here I've made it a little more clear and a little more short and brief. So I'm going like this, okay? I'm telling the patient, the parent, that I'm here to discuss or I'm here for the discussion about the blood transfusion advised by the doctor. So that's why I'm here. So the parent would say something like, no, I am not ready to do that because I am against it or something. The patient is going to give, the parent is going to explain that to you. So that conversation is not included in this particular segment. As I told you, this is just the explanation of the tasks. I'm just showing you how you can elaborate the task, okay, not the entire conversation. So here, let's see task number 2. Try to know why he or she is denying blood transfusion. Okay, now we need to know what is the reason behind it. So this is a good statement that you can use. I do understand that certain things are worrying you and I would like to know more about it as well. So could you please tell me as to why you are denying the treatment? Okay, so this is a good way of elaborating this particular task. So let's look into task number 3. Tactfully explain the significance of blood transfusion. Blood loss can cause severe fever, jaundice, decline in hemoglobin concentration. Permanent disability can be fatal. So we're going to explain why the blood transfusion is important and what might happen if it is neglected. So let's see how we can create a statement to explain this very on task. I do understand that you are so involved in your cultural and religious beliefs and I do respect it as well. However, given the situation of your child, it is very important he undergoes the blood transfusion as he lost a lot of blood in the accident. In order to avoid any sort of unnecessary complications like having severe fever, jaundice or decline in the hemoglobin levels, blood transfusion is recommended. Please note that since he has lost a lot of blood there are chances of permanent disability or in worst case scenarios it can be even fatal. Therefore, please understand the significance of blood transfusion at the moment. This is one way of doing it. If you want, you can try a different way too, okay, because sentence construction can vary from person to person, right? In a room of 5 people and if you give this task to all 5 of them, we can get 5 different statements because the way I create a statement might not be different, might not be the same like how you create it, might vary. It's not like it might vary, it will definitely vary. So you can create your own statement. I'm just showing you one way of doing it, okay? So you can try to figure out how you can come up with certain statements and how you can develop the statements from the very given statement here. So this is just one way of doing it. If I give you another example, you can try something by explaining this. Okay, I understand that you are very much involved in your cultural and religious beliefs, and I'm not trying to disrespect it. Okay, all I'm trying to explain is the importance. Okay, I can change the significance to importance of blood transfusion because your son lost a lot of blood during the accident, and if we do not transfuse the blood right now, it can cause many complications such as fever, or he might even get jaundice, and it will reduce his hemoglobin levels, and there is also a possibility of permanent disability, and in some cases it can be even fatal. So we do not want this to happen to your child. That's the reason why we have recommended blood transfusion. This is also another way of saying it, okay? Then this is one way of doing it, and the statement which I told you right now can also be another way of explaining the same point. The entire idea of sentence construction is to convey the message which is mentioned here in your own words. So you can practice it and then come up with a good statement. So that is task number 3. Now let's look into task number 4, which is pretty tricky but easy at the same time. Let's see how we can do that. Try to convince the parent and be respectful to his or her cultural beliefs. We can say something like this. I respect your values and beliefs, but at the same time, it is important that we treat your son at the right time. I hope you understand the seriousness of it because if neglected, it can cause many complications as I mentioned earlier. So could you please reconsider it? So we have already explained the complications that might happen if we don't transfuse the blood right now. So you can say this particular phrase like I mentioned earlier. Okay, so if neglected, it can cause the complications as I told you earlier. So please reconsider it. So this is one way of explanation for this particular task. Moving on to task number 5. Reassure the parent you respect the cultural values, explain the hospital policy if treatment denied, not responsible. So this is how we can do that. Please don't take me wrong, I'm not trying to disrespect your cultural beliefs. I have the best interests at heart. As he is just 16 years old and you being his legal guardian, you have all the rights to decide on his treatment. However, I'm sorry to say that according to our hospital policy, if you're denying the treatment, we won't be responsible for anything unpleasant that may happen. Therefore, we would require your written consent for the same as well. I hope you're following me. So this is a very professional way of explaining to the patient or the parent that if the treatment is neglected or if you're not ready to continue with the treatment, we won't be responsible for anything bad that might happen. Okay, so this is a sentence construction for that. So I hope it is clear for you guys. So in this particular feedback session, I have taken all the tasks and shown you how to construct that particular task. And if you want to refer or if you want to know more about how to move from one task to another and what are the empathy statements or the reassurance statements that you can use in this particular role play, as you can see in the demonstration of the role play, you can see how the nurse was trying to move from one task to another and how she was trying to build the conversation as well. So that can be used as a reference for you guys. Alright, by that we have seen how we can do this role play as well as to construct statements too. I hope these videos are being really helpful for you guys. If yes, let us know in the comment section and I'll come back with another video very soon. Until then, take care. Bye-bye.
IILT, it's my cup of tea.